Two of the country's leading health officials say the big beautiful bill has provisions that will help address some issues within the healthcare system, including Medicaid and funding for rural hospitals. HHS Secretary RFK Jr. and the Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz have also pledged to fix the broken system of prior authorizations by insurance companies. And joining us this morning to discuss, Dr. Oz, good morning to you, sir. Thanks for joining us.
Good morning, Jen. Prior authorization, folks will know because 85% of us have been affected by wanting to get a test with your doctor or procedure, and all of a sudden the insurance company butts in and says, wait a minute, does your insurance really cover this? We got to double check, and it takes weeks, sometimes months. Folks can be very frustrated, and it happens at a very vulnerable time. So thank you for bringing it up.
Well, Americans shouldn't have to. They shouldn't have to negotiate with their insurance company to get the care their doctors say they need. So what have insurance companies agreed to do?
So we went to the insurance companies and we said, you don't like this, right? Because you're getting your executives murdered literally in the streets. That's what happened in December when an executive from United Healthcare was shot down in cold blood, and the murderer, alleged murderer, said that it was because of prior authorization rules, which of course are infuriating. They also bother doctors a lot because we do about 40 pre-authorizations a week, and these prior authorizations take about 12 hours of a doctor's time. And so it's actually destroying the fabric of the system. So the insurance companies came in, we met with them, and we said, if you don't do it yourselves, then we're gonna do it for you. And I can tell you it won't be nearly as nimble and as efficient if we do it at the federal government level than if you guys get together and for the first time actually do something that in the Bible is described as being meek. Now, Jan, when I was growing up, I thought the word meek meant weak. You know, why would the weak inherit the earth? Didn't make sense to me. But it turns out the word meek means you've got a sword, something sharp that you could do damage with, but you decide to sheath it. You put it away for a while so you can sit with your competitors and figure out a better way. And that's what the industry agreed to do. They pledged to us in public that they were going to work through this pre-authorization process. Prior authorization now can be done digitally. It can be done immediately, quickly. So at least if you're going to give bad news, like you can't get that procedure, we don't cover it, it needs to be done immediately or fast so that you actually can tell the patient and the doctor in a time when they can reassess what needs to be done. And a lot of the angst people feel is because they're nervous, they're anxious, and they're afraid of what they don't know. So by giving them certainty, some feedback quickly, the right decisions can be made.
You said these insurance companies have pledged to this. How is it going to be enforced?
One of the things they've pledged to do is to create a dashboard, a very public document that we'll be able to all assess. Are you really making a difference in the number of times that you're asking for prior authorization? Is it happening fast? I mean, ideally instantaneously, like a credit card. If you put a credit card into the machine when you're buying something, they don't have you wait 3 weeks to find out if you have enough money to afford it. They tell you instantaneously. All this is part of the dashboard. If they don't do it, then we have commitment from Congress and from the Senate. And of course, we have a rulemaking ability here at the agency with Secretary Kennedy and myself to put in place draconian rules if required to enforce what we desire to happen for the American people. They don't want to see that side of government. So I do think they're going to act, but I also believe they're motivated. These people went into healthcare initially anyway because they cared about health. Yeah. Now, many times, and we were honest about this, it seems like they've lost their way. They're so focused on the dollars and cents that the importance of the actual human being behind those premiums gets forgotten. I think they appreciate that. They don't want to be that person either, so they've taken bold steps forward. And the organizations to which these companies belong, the biggest insurance companies, by the way, that we had 75% of all American insurance companies represented in the room. Wow. When we met yesterday. So they're all here. They're agreeing to speak in one voice, and I have confidence they'll do something. Is it enough? We'll find out.
That's impressive you had that many. All right. You also defended Medicaid changes with the big, beautiful bill, including a provision requiring those non-disabled Americans under 65 who are not caregivers to have some type of work. Tell us why this particular provision is so important to the overall viability of Medicaid and really the healthcare system.
You know, Medicaid was created 60 years ago in July. And there's a plaque at the entrance to this building. I'm in the main Humphrey building in Washington, D.C., across from the Capitol. And Hubert Humphrey has a quote there. And he says, it is the moral obligation of government to take care of those at the dawn of life, the children, those at the twilight of life, the elderly, and those living in the shadows. That's why Medicaid was created. At no point did anyone ever envision that able-bodied individuals who could work would be covered on Medicaid, a program designed for the population I just described. So we have an obligation to keep the program healthy and able to take care of people who can't help themselves or need more help than others. But we have to do that by allowing folks who can work to get off the couch and do just that. The average able-bodied person on Medicaid who's not working spends over 6 hours watching television or just hanging out.
Okay.
So we're asking them to prove that they actually have agency over their future, that they want to make a difference for the world. Go out there for 20 hours a week, volunteer, get educated, get a job, do something that shows that you're going to make the world a better place. If you do that, we'll give you free health insurance.
Very quickly, I got to ask you about rural hospitals because the bill freezes a health care provider tax. Rural hospitals say they need to cover Medicaid costs. The provider tax has some issues, though, so what's the fix for this very quickly?
The provider tax goes primarily to rich urban hospitals, or at least hospitals that are connected to the government. If only 5% of the money goes to rural hospitals. We need a better solution to help rural healthcare. We're going to do it with a direct infusion of funds into the healthcare system in rural America to make sure those Americans get the high-quality care they deserve.
Dr. Mehmet Oz, Administrator for the Centers for Medicare and Medicaid Services. We appreciate you joining us this morning. Thank you.
God bless.